Welcome, everybody. AEP 2027 edition of Insurance 360. Rob?
Cheers. Add another gray hair to my head.
There you go.
It is possible, people, if you're watching the YouTube, I can get more gray hair. It's not fully gone yet.
Yeah, there's a lot going on. I'm not going to lie. There's a lot going on. We've been starting to see little glimpses of the first looks for Medicare. Carrier events are kind of rolling out. I think some of it is what we expected, right? We've been talking about 2027. Still going to be a lot of turnover as far as what's going on in the Medicare space, Medicare Advantage specifically.
Yep.
Nothing changing. I don't know if nothing changing, but Part D, we don't expect Part D to be commissionable. I mean, that may never happen. Let me just say that. I mean, those changes, that might just be sort of the way that is. But
definitely the nail in the coffin for it.
Yeah,
from a commission standpoint.
Yeah, exactly.
Plus, they raise the commission, so it's like,
yeah.
I mean, I don't know. It just can't. It's not sustainable at the end of the day, which is a shame because I do think Part D requires a lot of legwork. I mean, I'm talking to agents every day, and it's like, they're like, we want to help people, but at the same time, there's a lot of service work you got to do.
Well, I think it's part of the process in general. I think agents know this. I think as you're working with not only existing clients, but when you're working with new people, I think what happens, as part of the process is you start going through a needs analysis. It's the prescriptions, it's the doctors, it's specialists, it's conditions. It's going through all of that, talking to them about the options, right? Talking to them about the Medicare Advantage options, Medicare Supplement options, whatever they may be. And you're really doing that. You're a service person.
Yeah.
First and foremost, you're helping solve that problem, which is, let's get you in the best possible health care for your situation. It's not easy, but that's why we're here, right? If it was easy, anybody could do it. They could just go online and click a button and get it. And that's just not the way it works. To be perfectly honest with you, I don't think we want it to work that way, right?
Yeah.
So that's just part of the process.
I mean, if you're planning for AI to take over, especially in this space, I just think that there's just so much gray area where you need a human. You need a human touch with a lot of the stuff that we do.
And we've talked about it a lot. AI as a tool to help you, analyze the situation, help you with your existing book. There's obviously a lot of things that AI can do to help you manage AEP. But let's start let's start at the beginning. Certifications. We've been talking about them now. Is everybody out at this point? Do we see all the carriers making the certs available? What's happening with certs?
All of the main guys are out.
By main, you mean more of the national players?
More of the national guys, right? Your Humanas, your Uniteds, your Aetnas, your Cignas. It's some of the regional carriers still aren't out. We still don't even have dates for a couple, which is, kind of worrying.
We should wait a little bit longer on that. Just take your time.
Oh, you want supplies?
No worries. Good luck. It's all good.
Expedite, right? So we are still waiting on a couple, but a majority of the carriers are out. Majority of them really haven't changed much. There's a couple new things in there with some of the new rules and regulations. A lot of people are honing in on, obviously the scope of appointment changes from, the 48 hours being gone, retention. You see some questions asking about how long you need to keep voice call recordings because that's changed a little bit. So some of those have been peppered in, but for the most part, it's pretty status quo with a lot of them. Yeah,
and we have had some positive changes. It's a good point you bring up when it comes to marketing. So scope of appointment changes. We know, the 48-hour scope rule, which was sort of just an annoyance. It was just an annoyance, right? It wasn't helping anything. So that's gone. And then we've got the change where if you're doing an educational event, you can actually do a sales event following it. There's some rules to it. You got to sort of tell people, hey, this event's ended. Feel free to go. We're going to start another event, which is going to be more of that sales event where we can get into more specifics and more, information if you'd like to stay for that. So there's no longer that waiting period that was 12 hours. Yeah. So, I mean, that's good that that's no longer. And then call recordings, we still got to, you still got to do the call recordings. As far as saving them, it's what, 6 years,
6
now
years, yeah. And you can
versus 10.
doesn't have to necessarily be the recording. You can also use a transcript after I think the first 3 years or something along those
Yeah.
lines. So
And also the disclaimer changed a little bit, right?
yes.
So you no longer have to talk about the ship part of it, which again, you no longer have to talk about it in the first minute of the call. Is, almost like, hey, hello, how are you? Let me get into this disclaimer, because that
You basically
somehow that made sense. But as long as you have to go through it at some point. But so this made some of those changes, and not going to go into every detail of every single one, but you should probably either get the info from the Pinnacle website, or if you have questions, just contact the Pinnacle team. They can go through some of that in more detail with you. And we do hold a lot of webinars on those kind of things as well. So if you're not sure of all the changes for this upcoming AEP, like those that we just discussed, you should make sure you discuss it with us.
Hey, before we keep going, Bob, if you're finding value in Insurance 360, take a couple seconds and hit the like and subscribe button. It's going to help us grow the channel, reach more insurance professionals, and guess what? We can continue to bring you conversations that help build your business. Thanks. Want to get back to it?
I mean, look, it was always weird, having to pick up the phone, and I had to tell my client before, I hit record, like, hey, just so you know, I have to say a disclaimer that's required by the government, and I have to say it now, and it's good that they moved it into the point where it could be more thrown into the actual conversation.
Right.
Right.
Yeah.
So some of those changes are good. And
Yeah.
hopefully they will continue to get a little bit more laissez-faire with some of that stuff. The educational event one's great. I mean, how many times do we have people that they spend a lot of money to do an educational event, but they can't even try to capture any of that business afterwards. So definitely positive changes, which we're not used to here. I think of the final rule, you hear that, you automatically think everything is bad,
Yeah, exactly. So we're starting to see some of the first looks come out. And I will tell you, this year, more than any that I can remember, the first looks are a little bit less detailed, a little bit slower at coming out than they were previously. Usually by the end of August, I would have most first looks available with some detailed information, and that's just not the case this year. There's some rebid information, not to go into the weeds on that, but I know some of the carriers are even talking about some of the rebid information. And I think there's a lot of strategic thinking when it comes to the carriers, we'll say, for this year. So we've seen some of the SARs, the service area reductions. Yeah. And we're going to see more of them this year. Listen, we talked about it. We're going to see more SARs this year. That's just going to be the case. The carriers are being very strategic on where exactly they are going to continue to do business. It's going to be areas where it makes sense for them, and from a profitability standpoint, they have good networks. They can manage those plans in a way that makes sense for them. And there are going to be just some of those areas, and we saw some of it last year, and we're going to see more of it, I think, this year, where you're going to see more SARs. It's just the way it is.
Yeah, and I mean, the reasoning behind it makes sense, right? I mean, a lot of it's they're focused on retention. Every single carrier at this point, that's been the main point, is not losing any members. So they're doing everything they can, which includes, holding their plans kind of to the chest until we kind of see that. Because, with the Part D, with those subsidies, going away, I mean, we don't really even know what that's going to look like from a cost standpoint.
Yeah, Part D will be interesting. Certainly hope, hope's one of those words where it's like, it's not a lot of concrete behind it, but you certainly hope that the impact to Part D premiums is not drastic, because listen, when you look at somebody who's on a Part D for their health insurance, what are they typically doing? Getting a Med Sup. So if you got a Med Sup, and we've talked about it on other shows here, that where the pricing's been increasing over the last couple of years, higher rates than ever before. And now you're going to throw on there that the Part D premiums could also start increasing. Could be other impacts to the Part D besides the premium, maybe cost sharing, co-pays, all of that can change. Yeah. We haven't seen it yet. So higher cost of health insurance overall to members could be happening this year. Not just the Medicare Advantage side, but also the Part D, and those individuals that are on the med sups. I mean, it could impact us a lot.
Yeah, I mean, look, I'm an agent, right? You're an agent. I have people on both, and it's definitely going to hurt the supplement people because you have a lot of these supplement people. I mean, at least for me too, they don't take any meds. So you get them on a $8-10 PDP plan because they just need something to satisfy the requirement. But if that goes up to $50 or $60, it's in the grand scheme of things, it's still not crazy, but it's still a lot of money.
It's still
right?
a big
It's
jump.
a huge increase.
Yeah, it's a
you're
big
talking a
jump, and that's
5x
in the
increase.
sticker shock, right?
Yeah.
For somebody, hey, I was paying 20 and now it's 30 or 40 or 50 or whatever the new amount's going to be. It's sticker shock. And then when they go to the pharmacist, they were paying, $10 and now it's 15 or 20. I mean, everything adds up, especially for all the individuals that are on fixed incomes out there. It impacts them.
Yeah, and not to mention, look at supplements too. Supplements. An average increase so far that I've seen is roughly it's over 15%, which is way more than it's been in the past couple of years, and that's a lot of it is due to the impacts of the IRA, the Inflation Reduction Act, and some of the other things that's going down. So, look, I know we're doom and gloom all of a sudden, but I think. After this year, I think we're gonna start to see maybe a bounce back. We just have to kind of get through some of this craziness.
Yeah, and it's a good point. We've talked about it that it's really that 2027 that the carriers have been throwing out there. I will just say, take it with a grain of salt. Listen, if 2028, if things aren't changed and the carriers still feel like they still need to do some things, that will still happen.
Yeah.
So we're saying, listen, we again hope that 2027 is going to be sort of that stabilization year.
Yeah.
We still could see more in 28. Obviously we're far away from that, but focusing on 27, we're going to still see SARs.
Yep.
The good news is that if you're planning, we as an organization are going to have a lot of that SAR information prior to pre-sale where we can at least help you plan. Like these are the areas, if you have clients in these areas and we can help you because we can, if you're using Pinnacle's boss system, you already know you have your entire book of business in there.
Yep.
So you could easily pull these SAR locations and we can help you manage how many of your clients could be part of the SARs. And, these are ones you're going to have to move them into something else. So that's where that prep comes in. Having a CRM like the Boss CRM can help you manage those types of things. And I know, Rob, we've been working on a lot of retention correspondence in the Boss CRM where you as an agent can actually send out correspondence to your clients prior to AEP, letting them know that, hey, we're going to need to meet. We're going to need to discuss a new plan with you, whatever the case may be. Those could be really important touches that you have with a lot of your clients this year prior to pre-sale so that you hit the ground running October 1st when you can start talking to people, right? Let's not wait till the 15th. The 1st, you can actually start having these conversations. It's really important.
Yeah, look, statistically, the more touches you have, the more likely you are to hold on to that person. Look, my dad's 62, and he probably gets 30 calls a day at least in regards to like Medicare related stuff and policy. So if my dad's 62, I'm sure someone that's 64 and a half, or that's even your client currently, they're getting inundated with calls and emails. So you got to make sure you're top of mind where you can, and a system that automatically does it for you. Sign me up.
Yeah, exactly. It's really important. So let's separate a little bit. I know it's a little nuanced, but there is a little separation from what is a SAR, a service area reduction, and something else we're going to see a lot of this year, which are plans being terminated, new plans being made available by the carrier. So an old plan that was, we call it underperforming plan, the carrier is going to get rid of it. There's going to get an ANOC letter. Those of you in Medicare are familiar with ANOC letters. The client gets that. Says there's a change to the plan, which in this instance could be very well a plan termination. But that carrier actually has another plan that they would like to retain that membership, that they would like you to migrate that client to. So it's not service area reduction is like that carrier is no longer going to have a plan in that area, but there is something that the agent's going to have to do to help that client move into something else. So that's important, the distinction, but we're going to have a lot of plan terminations. At least that's what we're hearing, right? We're still gathering data. We're still in August, right? So not everything's been given to us as of yet.
Yep.
We're started developing that big picture right now, but I think we need to be prepared for that as well.
Yeah, and the carriers aren't crosswalking a lot of this stuff either, which means, a lot of times they're just going to automatically put them in a different plan. They're not doing that. So it is a true termination. So you as an agent, now they're saying, a lot of them are saying, hey, we're going to direct people to our office and direct them to call in, and we'll move and we'll protect you. And I'll just tell you this, I'm not saying don't trust the carriers, but as a business owner, you want to make sure that you're keeping track of all that. So that way you can reach out, take the preemptive, you move them, right? Because then for sure they're moved. It's got your name on it, your NPN, you're good to go. Everything's updated in your CRM and your system. And that's the path I'm going to take, because I want to make sure my clients understand as well, because it can be very just for someone that's been on the same plan for a couple of years, it can be very confusing to see that ANOC letter, and it also can give them a lot of anxiety as well.
Yeah, exactly. And then if you're not reaching out to them, they got that letter that talks about a planned termination, then they start getting these calls and letters in the mail and get invited to other agent seminars, and they're like, well, I guess I need to talk to somebody and do something. So make sure that it's you. So it's really important. Again, here at Pinnacle, if you're using our tools, you have an entire book of business at your fingertips, and we can work with you to look at those planned terminations, where they're going to happen and with what carriers, once we gather all the data here. And then we can also look at the SARs, and we can help you really strategically make a plan that you can start reaching out to individuals and letting them know that you're going to need to meet with them, discuss with them changes to their plan for the upcoming year. So it's important this year that you keep an eye out for all that information that's coming out. And I say it all the time, make sure I know it's like a fire hose sometimes, there's a lot of info, but make sure you're following us on social media. We try and keep it simple. And it's like, here's the info. This is what we know from this carrier. This is what we know from this carrier. And here's an update, and so on and so forth. Here's how you can get us if you need us, those types of things. So make sure that you are on top of all that. And we're glad to help. That's what we're here for.
Yeah, exactly. And I think that's why when we started, right, we started with talking about certs, because, there is kind of a letter list to this, right? You're getting certified, you're getting your stuff, making sure you're ready to sell. You're figuring out if you have all of your necessary documents you're going to need, like your policies, if you're writing paper or things like that. And then going into this, because you don't want to be doing certifications and getting ready to sell, trying to plan all the marketing, coordinating all these things, because things can fall through the cracks, and you just got to be prepared. It's just really important, especially starting now. If you haven't, you got to get there, man, because there is going to be a lot of movement, and you don't want someone else, some Joe Schmo coming up and taking your clients, right?
Yeah, and then part of the planning, I think it's important, because we're talking about, again, from last year, we know there's some areas became pretty barren with options. A big part of that, even in some really traditionally really good Medicare Advantage states that really have gone sideways, we've seen networks being a real issue. Yeah. Networks not playing nice with Medicare Advantage companies. And to the point we talked about earlier, the carriers are being very strategic. If they cannot make a plan where they're not going to lose a ton of money and put it in a certain state or a certain county, there's a reason for that. There's a reason, because if it made sense for the carrier to do it, they would be doing it.
Yep.
So let's keep an eye out and have an open discussion, because in some areas, in some states, you better make sure you have a Medicare supplement if you've got clients there. I mean, at the end of the day, you want to make sure you have an option, because that may be the option that's available for them. And that's a little bit different of an animal, but it's either that or go back to traditional Medicare a lot of times. Like, what are the choices going to be? So you still want to be that resource for your individuals, your beneficiaries, your clients, that are going to need your help more than ever in a lot of areas.
Yeah, you don't want them having nothing because at the end of the day, you're probably going to be the one that they call if they have to go to the hospital and they realize that, Medicare covers 80%, but you're on the hook for the other 20. And if it's a $20,000 bill, it's that those aren't fun conversations to have.
No,
So
not at
I don't
all.
want to be on the end of that convo. And
Not
I'm
at
sure
all.
everyone else watching this doesn't
Yeah,
either.
and plus, I mean, a big part of the conversation this year, and every single company is pounding this. So take it as fact. This is true. You do not want to have a lot of complaints this year. Quality business is what they're calling it, but there's different things. So you're looking at complaints. You don't want them. And with all the volatility, that means you have to make sure you're on top of things with all the changes. You know the way complaints work. They call and all of a sudden it's a complaint on the agent and it was nothing that the agent did wrong. Network changed or whatever it is. So you still have to be aware that could count against you. So you don't want complaints. So we got to make sure we're on top of that. And you want to make sure you have really good retention. It's critical. It's more critical than ever. The carriers are even talking about if your quality business falls below certain levels, they may take away access to selling some of these big companies. So imagine you're getting some complaints and your business is falling off, and some of it is not even really something that is your fault, let's say. It could impact your overall business. So we don't want that to happen. So if you need to have that quality of business conversation, get with your Pinnacle team member today. And if you're an agency, that goes for your whole agency, right? All your agents in your agencies. You could have somebody who's writing a lot of business, Rob. And if they're having a lot of complaints, imagine them losing, the ability to sell one of their major companies.
Yeah.
That could really hurt. So it's important that we're on top of this. Quality business, retention. These things are critical.
And I think, look, since I started here at Pinnacle, we've always preached, let's not play in the gray area, right? And I think sometimes some of us like to live in that gray area, right? Let's not do that, right? Medicare is black and white. There's a lot of things. Look, we know that there's a ton of regulation. We get that. You got to record your calls. You have your scope of appointments. You have all these time frames. But at the end of the day, make sure you're recording your phone calls. Make sure you have that signed scope of appointment and, do whatever you can because a lot of times they're going to take the client's word, right? They're not going to always necessarily. Now, if you have a call recording, totally different story. But if you don't, that's on you. So we like to play the black and white area here. Don't play the gray area. Do what you're supposed to, and you will alleviate a lot. I mean, some of the carriers even now have a enrollment checklist, right? Connextra has a checklist
absolutely.
before you start. Did you talk to your client about these things? So just follow that. I know it adds more time to an appointment, takes a little bit more time to finish things out, but at the end of the day, it protects you and your client.
Yeah, it's a great point. The more time you're spending at point of sale going through the benefits and the process, when they're going to receive stuff like their membership cards, all those things, making sure that they're really up to speed on it. And I know sometimes it's a lot and, the members could forget, it's a couple months later, but that's where those additional touches come in. Are you sending out those emails? Do you have automation set up? Are you reaching out to your clients in the new year, making sure they got everything? Again, going through the benefits that are available to them. Things like OTC benefits. Are they using them? Do they know how they work? Are they taking advantage of them? These are really important touch points to make sure that your retention is strong. And that's something you have to, if you don't have something set up, you don't have a retention program. I know if you're on social media, you hear a lot about the retention programs, but it's really important because a lot of people fall off just because they don't know. It could just be that they weren't aware of something or they thought if something worked differently and then they drop off and they change to something else. Remember, in OEP, they can make a change to something else if somebody else tells them about this other plan that has OTC benefits and your plan maybe had OTC benefits too, but they weren't aware of them.
Yeah.
Right?
Yeah, and I mean, I know that the call center stuff isn't as prevalent as it was even 2 or 3 years ago, but they're still around and they're still making calls. And
Tons.
They're going to be making those calls during January, February, March. So it's important to have some sort of a retention system, whether you're using our boss system or not. You need to make sure January rolls around, you're talking to your client. I would call them in February, and I would call them in March too, just to be safe. Hey, did you get your cards? Hey, how's it? Have you used your plan benefits yet? Like, you want to have these things in place, and it's nice to know that, like, if you are using our boss system, we are going to be rolling that stuff out so that you don't have to worry about creating that stuff yourself.
It's really important. And one of the other things, because you're going to really spend time, like we're talking about today, doing really good fact finding, one of the things that carriers are really, which I think is a big positive, is they're rolling out a lot more of the C-SNP plans. So we talked about on other episodes, C-SNP being the new D-SNP in a way, right?
Yep.
If they have one of the chronic conditions, if there's a plan for that chronic condition available from one of the carriers, they really have an SEP all year round to enroll into that plan. And these plans are tailored and geared towards individuals that have those conditions.
Yep.
So if we can get people that have these chronic conditions into a C-SNP plan, it does make them more sticky, but there is one extra step. So if you haven't sold C-SNP before, be aware there's a verification process. And we actually have a lot of information where we put trainings available on the verification process where a doctor, a healthcare provider, they have to confirm with, typically it's in the first 2 months. That's pretty typical, that the client actually has that condition. It's just a form that has to be signed saying, yes, this client has diabetes. So they can get the diabetic C-SNP plan. If the carrier doesn't get that, they will get disenrolled. Again, this goes to retention. We want to make sure we have good retention. C-SNP, big opportunity, not only for agents, but also for clients getting in the best possible plan for them in many regards. So if you're not up on the C-SNPs, again, get with your team here at Pinnacle. We'll do some training with you. We do a lot of generic trainings, but you can have one-on-one trainings with your with the sales team. That's easy enough to get set up. So make sure you're taking a look at C-SNPs as well.
Yeah, I mean, it's it's really easy to think that a lot of these carriers are all going to have the same rules and regulations, and I got to tell you, it is not. So, especially with C-SNPs, they all have little variants. We have a whole little playlist on the YouTube that you can check out that lists a lot of the major carriers with what they have going on. We're going to keep adding to that because we feel like there's value to knowing those little intricacies. Because at the end of the day, we want you to be able to retain your own business, and C-SNPs are a great way to do that.
Yeah, exactly. So, again, getting certified, making sure you're up to speed on all the carriers that you need, having conversations about, could there possibly be SARs and plan terminations in areas where you have your book of business. Make sure you get the marketing set up, having ancillary products like hospital indemnity, having all the med subs set up that have the best price, best options, some underwriting considerations possibly, because that can vary a little bit carrier by carrier, making sure you're getting all these things ready to go prior to October 1st, which is pre-sale, right? Oh, so that you can start talking to these individuals right up front. Is more important now than ever. And I think we say that every year, but it's really very important that we get everybody up to speed early this year.
Yeah, and I look, the what I want to make sure people understand too is there is Medicare surveys that are available. Sunfire has BlazeSync, it's through their platform. RetireFlow is one. We have great relationships with both of them. October 1st, they are a great way to reach out to your clients. They will collect all the information from your clients and add all of those people into your system, and it will update all of their drugs, their doctors and pharmacies. Oh, and guess what? There's a scope of appointment at the end. I think every training I do, I try to mention these, and I can't tell you enough. 9 out of 10 people don't even realize they have access to it. Not to mention RetireFlow just has a new integration with our boss platform. So there's some really cool things out there, some helpful tools that you can use October 1st that I really think could look. I know we deal with seniors. I know that there are some aren't into technology, but even if you have a book of 100 people and 30 people do it, that's 30% less people that you had to talk to on the phone. And maybe you got a talker. I got a couple talkers. And maybe they were a talker and they just did it for you, and that saved you an hour of talk time. So, time is money in our world, especially starting in October. So I always like to make sure people know that the surveys are available and you do have access to them. Yeah,
this is where you really look to take advantage of the technology that's out there to help you be more effective, more efficient. It's a great to use these tools. If you're, again, not sure, get with members of the Pinnacle team, help you with strategy, help you with getting set up with the technology. Make sure you know how to use all this. Make sure your certifications are all done. You know, we can walk through all of that with you. It's August. October will be here very quickly. I'm just telling you, time is going to go very quick. September will be a blur, and then it's going to be pre-sale. So you don't want to wait to the last minute to get all these things, all these ducks in a row.
Yeah.
Start
Couldn't agree
talking
more.
now. Yeah, exactly. AEP 2027, it's upon us. Rob, certifications, we're still going to do webinars and trainings all through September, right?
Oh, yeah.
Yeah, so if you're not sure of which ones you're signed up for, you can always go to the Pinnacle website, pfsinsurance.com, and get yourself signed up right there on the events page if you like. But again, we can always do one-offs and individualized training, making sure you got everything you need. So you just got to reach out, and you know, as little as much help and assistance, we're here for that, right?
Yeah, we're gonna keep cranking them out, man. We have quite a few webinars already set up with some of the reps and things like that I think are gonna really help people. So just be looking for emails. We like to email stuff out, and if you follow us on socials too, we'll be posting that stuff on
Yeah,
socials.
more first looks to come, I'm sure. There's some of them out there already. Again, they're on our website. If you have access to the pfsinsurance.com website, you can look at which first looks are out there, and we add them as we get them. So as the companies are giving them to us, we're putting them on the website. So, you know, keep an eye on that, and we'll make sure everything gets updated in real time so you have access to the latest and greatest.
Yeah, man. Let's do it.
Yeah.
Can't believe it's here already. So.
Deep breath, everybody.
Yeah.
It's going to be great. No worries. We got this. Rob,
We're gonna crush it.
there you go. Thank you, everybody, for joining us.
Cheers, people.
AEP 2027. Let's go.